So, what do the liver and the blood vessels have in common? As we know, everything's connected, right? The knee bone's connected to the thigh bone. The liver is connected to the blood vessels because the liver actually produces cholesterol. Did you know that? The liver produces cholesterol. So, here's the thing. There's a bit of an argument going on between our body and ourselves at times. Is when we get a lab test done and we get that lab test back and it says that our cholesterol is high, we might get recommended to take a medication for that as a result in order to protect our heart as well as our blood vessels. But then again, here's the liver producing cholesterol. Why is that? Well, there's a couple of reasons, and you know, cardiovascular health is very complicated, and I would encourage you to ask as many questions to your doctor as you can and to really, really listen to what your doctor is saying, because this is not a simple situation. So if you're making your own decisions or if you're going on the advice of the doctor, just make sure you're very, very well informed. I could never give you all the information you as an individual needs in a video. But if you want to talk about your own individual cardiovascular health, come on in and we'll have an appointment, and then I'll explain it to you in the context that's right for you. But in the meantime, did you know that the liver produces cholesterol? Why would it want to do that? Because LDL, you think of it as like patchwork. So we've got blood vessels and we've got a bunch of fluid, blood, going through our blood vessels. It's a very important system that we have. And if there's high blood pressure for a long time, sometimes in a constricted blood vessel state, there's just too much. I like to think of it as splashing. So as the blood goes through the blood vessels, sometimes it hits the wall of the blood vessel a little too hard, almost like a splush, as it kind of goes around, because you got to go around turns and twists, right, as we go through the blood vessels. So I like to think of it as splashing along a wall, the artery wall or the vein wall, so that if there's like a constant, I grew up by the ocean, and so I know what it's like to have water constantly hitting one spot on a dock. And eventually, it's going to wear that wood down a little bit over time. It's going to take a long time, but it does happen. And so the body's response to that, if it determines that there's a weak spot, a vulnerable area in a blood vessel, it'll patch it up with cholesterol, with mainly LDL is the preferred choice. It's almost like patch up that weak spot or that vulnerable spot that's in the blood vessel that the body has decided is so. The body is very intelligent. And this all happens subconsciously while we're busy doing our day and doing our other stuff and having our life experience. This is all going on in the background. Do you have a little more respect for your body now? Because I sure do. Now, there's also the good cholesterol called HDL. So I personally like to think of HDL as the cleanup crew. So after the patchwork's been done, the cleanup comes in and goes, okay, is there anything like residual from that patchwork that's in the bloodstream? Maybe there's a little extra LDL we don't need. Or maybe there's a super high density lipoprotein, or there's an apoprotein, or there's some other thing that the body has been using to help keep the blood vessels as strong as possible. And can I just kind of remove all the extra stuff there that's not needed? Maybe I used a little too much sealant here. Maybe we can take some of this off and it's still just as strong. Oh, there's some over here. Maybe just grab that. And so the HDL goes through, and that is a very, very basic, almost a storytelling way of explaining cholesterol. If you're interested in more science and more accuracies, I would encourage you to definitely look that up and determine for yourself how you want to perceive this process. But in the meantime, I do find it helpful to look at things that way. So those things go back to the liver, and the liver then has to break that cholesterol down into its nutrient parts again, or into its protein parts again, so that those building blocks that were used for those cholesterols get to be used for something else. It's kind of like Lego when you think about it. And so as you look at the liver, you start to see that it's a bit of a manufacturing facility, isn't it? Building things, taking them apart. Hormones. So for example, maybe some of that cholesterol wasn't needed, and so it got broken down into its nutrient parts, and some of those important nutrients or cofactors or enzymes or whatever it is that the liver is producing and making at the time, maybe that goes to build some testosterone or some estrogen or something like that. Now the liver is not the only manufacturing facility in the body. There's a few different facilities. Liver's one of them. The liver is also a filtration system. So not only does it break down cholesterols and estrogens so that they're not floating around causing trouble after they've been used, but they actually get cleared out from the body if not needed. Because too much of anything gets to be a bad thing. It's all about balance with the body. You want a little bit, but not too much. Less is not always less, and more is not always more. But it's also a filtration system, and your liver has several phases to the detoxification process of the body. What's the detoxification process? What is that? Well, think of it as anything that is not nourishing for the body. Consider that to be either a neutral substance or a toxin. Okay, if it's a neutral substance, it's taking up space, so it should probably be broken down if it's not being used. If it's a toxin, it should most certainly be broken down into its most basic parts so that it's no longer, so it's less toxic, or it's no longer as toxic. So that when we breathe in some pollution, or when we are dealing with some fumes from the salon that we were at, or maybe our workplace, there's a lot of gasoline around, a lot of motor fuel, a lot of dust and particulate matter. Whatever the body can deal with and break down into its more basic parts, it'll do that, and the liver will do its best to help out. Once those things are broken down into less harmful substances, then the body has to get rid of it. So that's your organs of elimination that then come into play. We poop it out, we cough it out, we pee it out, we sweat it out, those types of things. So medications have to be broken down. Supplements have to be broken down. They're not 100%, when you take a supplement, it's not 100% this or that. There's other fillers in there, and sometimes those need to be used by the body. And so there's lots of things that the liver does on a day-to-day, and it's not necessarily all bad either. All very good things. Some bad. Some chemicals. There's a lot of chemicals in our environment, and the liver has many, many things that it uses to help break down or basically detoxify, deactivate, literally detoxify a substance that the body has deemed toxic, meaning not nutritive. And so it has things like vitamin B6, vitamin B5, riboflavin, niacin. These are detoxification nutrients. They do other things. They do a lot of different things in the body, but in the liver, they help in the detox realm. Fancy things like glutathione, sulforaphanes, methyl groups. These are all detox factors, I like to call them. They're kind of new nutrients. That I certainly didn't learn them in nutrition school. I learned them in naturopathic school. So the liver then is a filtration system as well. The liver is one of the most resilient things. You can take out a whole bunch of liver tissue, like more than half, way more than half. You can take that out and the liver's still functional. And it's still able to do its job. It's amazing. what bogs the liver down? What habits might bog the liver down? What has to be filtered through the liver? Alcohol. And so if we've been drinking a lot in the last few years, might be something to think about is to take a look at the liver function. Maybe not just look at the liver enzymes, because it takes a lot for liver enzymes to get out of range. I'm talking about lab tests, liver enzymes, the transaminases. It takes a lot for those to get out of range. So if they come back normal, it doesn't mean the liver's optimal. It still might, you still could maybe use some attention and care. Or maybe there's some detoxification factors, detox nutrients that have been that they got used up too much, trying to filter a whole bunch of other stuff through. For example, did you know that if we're a heavy drinker, we're much more likely to be deficient in a nutrient called niacin? That's vitamin B3. So that when our niacin stores get low, we can get symptoms of other things, including depression and grumpiness. Just not feeling good. Vitamin B3 is very important for our nervous system to keep us calm, but also to help build our happy hormones. Serotonin, dopamine. There's another link in the puzzle, isn't there? Another puzzle piece comes, click right back in. Everything's connected. And so the liver is very helpful in our production of our serotonin and our dopamine and our oxytocin, our happy hormones. We want to give the body those nutrients back that we're using to detoxify from whatever it is that we're using as our medicines or whatever it is that we're exposing ourselves to. Maybe we absolutely adore going to the nail salon, but we kind of feel headachy and just like off kilter afterwards. Or maybe we go to Canadian Tire. I have a Canadian Tire sensitivity. If I'm in there for more than 10 minutes, my head's starting to hurt and I'm getting grumpy and I'm clumsy and I'm just kind of just not myself, just like spacey. And that's because I think I've got some sort of solvent sensitivity to something going on, something in Canadian Tire. Home Hardware does the same thing. And that's just my thing. I'm pretty sure it's a culmination of what my body had to do in the past, and I now just deal with it. I can tell you if my diet has been better. I got a bit more resilience when I'm in places like that, and that does tell me that the textbooks and the environmental medicine research that's coming out about detoxification and toxification, I do think that those are legitimate. I'm not going to get into which nutrients or which foods to eat here because I don't want you to think I'm making recommendations. But I want you to get curious. I want you to go look it up. I want you to come see me and we'll talk about it. But there are things that we can do to restore the specific nutrients or detox factors that we have become deficient in as a result of overexposure to something that the liver has had to do. It's called a liver cleanse. You know, all this fancy stuff, and it really comes down to the basics. Supporting and optimizing liver function, giving it care, looking at it, getting curious about it, and thinking, if I was the liver, what would I need? What is the liver seeming to need? And if you're getting cholesterol levels that are coming back a bit high, and you're kind of confused about that because you've been making some good health choices, you know, maybe you could look at the liver or a few other things, including the liver. And those blood vessels, you know, that the body is just trying to do its best. So try not to be too angry with the body. It's just trying to protect the blood vessels. And that's what I have to say about the connection between liver function and blood vessel health.